22-year-old woman has new dysuria and increased vaginal discharge for the past week. She is sexually active with a new partner and does not use barrier contraception. Her temperature is 36.5 degrees. She has lower abdominal tenderness. For her investigations, her urine NAT test is positive for chlamydia trachomatis. What is the most appropriate first-line treatment? A. Azithromycin 1 gram single dose. B. Ceftriaxone 500 milligrams IM plus azithromycin 1 gram oral. C. Doxycycline 100 milligrams twice daily for 7 days. D. Azithromycin 500 milligrams 4 times daily for 7 days. Or E. Metronidazole 400 milligrams 3 times daily for 7 days. I will give you a few seconds to think about it. You can also pause the webinar if you need longer. So here we can see the correct answer is C, doxycycline 100 milligrams twice daily for 7 days. In the next few slides, we will discuss why that is the correct answer. Chlamydia is a gram-negative bacteria. It is an intracellular organism, meaning it enters and replicates within cells before rupturing the cell and spreading to others. Chlamydia is the most common sexually transmitted infection in the UK and a significant cause of infertility. For risk factors, being young, sexually active, and having multiple partners increases the risk of catching the infection. For symptoms, it's important to remember a large number of cases are asymptomatic, around 50% in men and 70% in women. Asymptomatic patients can still pass the infection on. When people do present with symptoms, the most common symptoms in women include abnormal vaginal discharge, pelvic pain, abnormal vaginal bleeding, painful sex, and painful urination. For men, some of the most common symptoms are urethral discharge or discomfort, painful urination, epididymoorchitis, which is the inflammation of the epididymis and testicles, or reactive arthritis, a type of arthritis that occurs because of an infection. It can be tricky to get your head around the swabs used for sexual health screening. There's many different types of swabs and uses. For chlamydia, we use nucleic acid amplification tests, also known as NAT. These check directly for DNA or RNA of the organism. NAT testing is used to test specifically for chlamydia and gonorrhea. They are not used for other pelvic infections. In women, a NAT test can be performed on a vulvovaginal swab, a self-taken lower vaginal swab. This is first line according to NICE. In men, a NAT test can be performed on a first catch urine sample or a urethral swab. NICE recommends a urine sample first line. Rectal and pharyngeal NAT swabs can be used to diagnose chlamydia in the rectum and the throat. It's important to consider these swabs where anal or oral sex has occurred. For management of chlamydia, this has been taken from NICE CKS guidance. First line for uncomplicated chlamydia infection is doxycycline 100 milligrams twice a day for 7 days. It's important to note that doxycycline is contraindicated in pregnancy and breastfeeding. Alternative options are erythromycin 1 gram stat, then 500 milligrams once a day for 2 days. Erythromycin 500 milligrams 4 times daily for 7 days, or amoxicillin. A test of cure is not routinely recommended. However, a test of cure should be used for rectal cases of chlamydia, in pregnancy, and where symptoms persist. Other important factors in your management plan are to advise patients to abstain from sex until treated to prevent reinfection, to refer patients to the genitourinary medicine department for contact tracing and notification of sexual partners, to test for and treat any other sexual transmitted infections, to provide advice about ways to prevent future infection, and to always consider safeguarding issues and sexual abuse in children and young people. There are a large number of complications from infection with chlamydia, including pelvic inflammatory disease. This is a bacterial infection of the female reproductive tract, chronic pelvic pain, infertility, ectopic pregnancy, where a fertilized egg implants outside of the uterus, usually in the fallopian tube, epididymolysis, and conjunctivitis, where chlamydia can infect the conjunctiva of the eye. There is also pregnancy-related complications, including preterm delivery, premature rupture of membranes, low birth weight, and neonatal infections, including conjunctivitis and pneumonia.